Dr. Andy Cole. I'm a pediatric bone marrow transplant physician at Nemours Alfred I. DuPont Hospital for Children in Wilmington, Delaware. Cord blood is the blood transfusion product that is harvested from the placenta at the time of delivery. So when a baby's born, the umbilical cord is clamped, and the part of the cord that's connected to the baby is cut, and the baby's taken away and cared for. What's left behind is the part of the cord that is connected to the placenta inside the mother's uterus. There is anywhere between 3 to 4 ounces, sometimes 5 or 6 ounces, of blood that remains in that placenta that would otherwise be discarded. And that blood is rich in fetal blood stem cells, and these are the cells that have the potential to regenerate a bone marrow, to make an entire new blood system, platelets, white blood cells, red blood cells. The most common diseases that we treat with cord blood transplantation, or with any type of transplantation, reflect the incidence of diseases in adults. So leukemias and lymphomas are the most common. However, if you look at children that need a transplantation, we still transplant for malignant diseases like leukemia and lymphoma, but we can also transplant for many non-malignant diseases. Some congenital diseases, or diseases that are the result of genetic mutations that are inherited at birth, can be cured with transplant, and many of these diseases would be otherwise fatal without transplant. When we do a bone marrow transplant, what we're doing is we're replacing a patient's bone marrow and immune system. The bone marrow is the part of the body that makes the red blood cells and the white blood cells and the platelets, and we replace that with a new bone marrow from a donor, and that donor can be an adult donor or it can be a cord blood unit. The transplantation process, whether it's an adult donor or a cord blood, involves a couple different phases. The first phase is we need to get rid of the patient's immune system, get rid of the patient's bone marrow completely. And that can be done with chemotherapy or a combination of chemotherapy and radiation therapy. And then comes the transplant. And the transplant itself is actually relatively easy. It's a simple blood transfusion, or very similar to a simple blood transfusion. The bone marrow product is infused through a vein, or if it's a cord blood product, it'll be thawed out, usually at the bedside, and infused into the patient through an IV. And those cells, they know where they're going. They know how to set up shop in the bone marrow and start to reproduce the patient's bone marrow. One of the big advantages of cord blood is that they're much more versatile. And because you're transplanting a relatively immature immune system into a patient, you can get away with less stringent matching between the donor and the recipient than you can with an adult donor. And if you look at a patient with difficult HLA typing, if you look at a patient, an African American patient or a Hispanic patient, who are historically difficult to find donors for, and you look and you search the adult donor registries, there may only be a handful of patients, or a handful of donors, if that are available and are a reasonable choice for transplant. If you search the cord blood registry, there may be 2 or 3 times that many cord blood units that are available and reasonable to use for transplant. Public cord blood banking is an opportunity for families to donate something that would otherwise be discarded after delivery of a baby. It's primarily the blood that's contained within the placenta, and that is all blood that will be discarded. It can be banked and frozen and then be used later for patients who suffer from many types of cancerous and non-cancerous conditions. And it's used in a process called transplantation, bone marrow transplantation. And this process, this treatment, can be life-saving for many patients with many different types of diseases.